There he is, brother.
Hey, Charles.
What's up
We're
there,
live,
man? Good.
Charles. We're live.
Uh, thank God I feel alive.
How are you, my friend, on this wonderful Friday, Aloha Friday afternoon?
Well, one day at a time, sweet Jesus, one day at a time. There's so much that's happening. That's why.
Yeah. Um, Unfortunately, we just had the press release from the county that two more cases on Kauai. Doesn't appear that any of them is travel related, which means the virus is still on the island.
Yep.
I mean, it's so hard to, uh, because we have so many people coming to Kauai, regardless if it's with exemptions or coming to work or whatever. It's kind of hard to pinpoint where it came from. It really is, because if you got these Honolulu people that are circulating amongst the Kauai people, maybe working together, whatever the case may be. But that's where a good contact tracing program comes in. But bottom line is we have two new cases, two men, residents, doesn't appear to be travel related. That is scary. That is scary. So again, the message is protect yourselves. Protect yourselves. I know. I got a call today from someone who is aware of a person on Kauai that just got notified today of a positive test. I'm not sure if that's the one of the two, but anyway, we have two cases tonight. Somebody's asking who's on tonight. We have Dr. Kimball. He was on a while back. He's the emergency room doctor up in Salt Lake City, Utah. He's also one of the founding doctors for the North Shore Urgent Care Clinic out there in Princeville. An awesome guy. And the one thing that sticks out, Charlie, we talked about this the other night, where he warned us. And is it about 2 months now? It's probably up close to 2 months, right?
Close
Since
to
he
too
was
much.
on.
He made that prediction. He made that prediction because of, I guess, I really believe he cares so much for Hawaii because he does have a home here, even though he's stationed up in Utah. That he kind of put out a cryptic message if we are not careful, because at that time Utah was having their out of control spike, and he said Hawaii could be just like them in exactly the same time right now. I mean, he called it. He called it.
Yeah, he was basically saying, 2 months ago from that time, which was about 2 months ago, he said if we're not careful, we're gonna see some major spikes, because we were starting to ease up on the restrictions, and he said specifically he didn't. He said 2 months prior to that date, Utah was where Hawaii was at, flat line. Very the curve had been flattened, and in 2 short months they were chasing New York with numbers. So I am so excited to have him on tonight. I have not spoken to him. We have communicated via email. So I'm really excited to have him on, and so curious as to what they're doing in Utah, and just getting his insight.
Yeah. Well, I think I do want to say mahalo to the nice comments. Thank you. Yes, this is another special shirt flown in from Honolulu for you viewers as well as everybody else. This is from the one and only Manu Heali'i. Came in today.
That's it. Do I have a Manu Heali'i shirt? I'm getting so tired of this nice shirt, Charlie. Now you get the same shirt as last night. Do we have a Manu Heali'i someplace? I think I have one. I know I got a ton of Ren Spooners, but I don't know about a Manu.
Yeah, that's damn good. You Red Spooners. That was a shirt in the day, boy. I
You
love
know,
Red Spooners. Love it.
back in the day. Yeah.
Oh,
So
it's
I'm
been
gonna make
around.
it
Oh,
famous
it's been
again.
around. I just love the material.
Yeah,
Principle.
it's wonderful. No need iron, and the
Yeah,
pockets line up straight. Like it's pretty
yeah.
cool. Yeah, most of
Someone
my shirts are all these Pop Warner shirts. It's, oh, this shirt's the best. Pop Warner shirts because it's free.
comfortable,
In
comfortable.
all my years running around with Pop Warner, every year we go to the Super Bowl and they give us free shirts. So that's my wardrobe. It's free. But I know
Principle.
I swear I get Manu. That's a. I swear I get Manu Heali'i. I think I'm gonna wear it tonight too if I have one.
In fact, I used to wear Manaola.
In fact, Charlie, you know what? Take over real quick because I'm gonna go
Yeah.
find my Manu Heali'i because I really feel I
No,
have a
you look,
compliment.
you look nice. I love that shirt. What is that?
Or
Super Bowl. It says there, Super
Super
Bowl. It's
Bowl. This is the Super Bowl 56, Pop Warner Super Bowl out there in Orlando, Florida. Yes, yes, and
it's a collector's item. Don't let it go.
yeah, yeah, we may
Don't
never have
let
it
it
again.
go.
Yeah, we unfortunately not really having oh, Dr. Kimball has a special announcement tonight. Ooh, Makaala. She knows Dr. Kimball. I am now I'm even more excited.
Yeah,
Um, I hope I sent him the right Zoom link, but yeah, he's going to be
yeah,
making an announcement tonight, and it's
yeah.
news. Oh my lord! Oh my lord!
Oh
Oh
my
my
lord.
lord! So
Well, folks. I wanted to send a big mahalo to the viewers that were. We had a fantastic show last night with Congresswoman Tulsi Gabbard and Dr. Scott Miskovich. Well, it's we believe we had a little play, but I understand that Lieutenant Governor Josh Green had a conference today and announced that N95 masks were delivered to the prison system, and they're gonna start rocking and rolling. So I really think that Dr. Miskovich is going to be in there to test everyone because they had more infections reported today, my understanding, and whew, I mean they got to jump on it real quickly because remember now they got over 250 cases so far, and my understanding there's close to 900 inmates in there, minus the 10 that was released early, so 920 something inmates. That's a lot of inmates if you only tested so far 250. You got a lot more to go. Got a lot more to go. But we want to thank all of you folks out there, and an update on our brother that we reported last night. Unfortunately, he suffered another. He's COVID positive, but he suffered another heart attack today. So prayers to his beautiful wife and Keikis, and we're all pulling for him because he is well loved by many. So when you deal with this virus, in fact, I don't know, did you see the post I put today about what they found out about the bubbles, the tiny bubbles?
yeah,
It's if you get a chance, folks, try to read that article that I posted, because now what they're finding out is these tiny bubbles that develops, and the lungs is supposed to filter everything out to oxygenate the blood. But what they're finding is these bubbles actually bypass the lungs through the largest vessels and go straight up to the brain. So that is the reason why the patient who suffers from COVID-19 isn't getting enough oxygen when they're on the ventilator. And supposedly it's from this tracking. They used a robot. They were able to use a robot and follow these bubbles, the path of these bubbles from the lungs to the brain. So it's not. I guess the oxygen is not filtering properly to get oxygen into the bloodstream and throughout the body. So it's unbelievable, unbelievable science.
well, everybody, this thing is so new. We're learning stuff every single day. So
Yeah,
anyway, Dr. Kimball is in the waiting room. I'm gonna bring him
he,
in,
he
and
is.
Andrew's asking about what year Super Bowl. I've been to a lot of them. I was a regional director for the Western region. So I went to, I don't know, 5 or 6 or 7 of them. I can't remember, but it was probably within the last 10, 12 years. So yeah, I'm not sure what this is. the 56th one. There's no year on this thing, so I honestly, there he is,
Yes, there he is.
the man of the hour, Dr. Kimball.
How are you, brother?
Are you
Good.
still
Good to
here in
see you.
Kauai or are you back in Utah?
I just barely got back, but coming back.
Oh man, darn the time difference again. Geez, I'm so
Yeah.
sorry, Doc. I was hoping to catch you while you're here.
No worries, no worries.
Well,
And
welcome back, Doc. God, it's a pleasure to have you back and just to get caught up on what's going on with you and what's going on in Utah and any other exciting news you may have for us.
yeah,
So Charlie's getting his. Oh, he's got a new one. Yeah, we have this high tech electronic system of, of graphics.
thanks,
Everybody, please
Charlie.
share. Please share. You know, last night we ended the show last night with 6,200 views. Um, and this show is growing, and it's all because you guys are sharing it. So please, right now, hit the share button, start a watch party, do whatever you want, but get this thing out because I have a mean feeling Dr. Kimball has some good information for us. So
Yeah.
I've been thinking about it honestly for a little while because I always appreciate the invitation. And while I was on island, I did hope to hook up with you guys and see if we could do it over there, but it just timing didn't work out. And I'll be back over again to what we did was we launched a dermatology clinic up there because there's a real need for dermatology on island. And so we now have that up at the McConaughey clinic in Princeville. So, but yeah, really focused on that. But as I came back, we gathered a bunch of really interesting data. And I know we've talked about many things, but since I was on the show last, a lot has changed. A lot has evolved. And I think the theme of what I wanted to say tonight is that what has evolved has in large measure proven what we were talking about the last time and what you guys have been saying all along. It just repetitively the data continues to show what we have both been nervous about, but also that the things that we can do work, that they actually do work. So I wanted to talk about a couple of those things and then, answer any questions that you guys have. Talk a little bit about the going back to school thing, which is a very different deal for, not that different, but a little bit different on Kauai, just because we don't have the prevalence of the disease. But back here, it's crazy. It's a huge problem, and my feeling is it will be a source of a third spike. But that I don't believe that just not going is the answer either. I think there's a middle ground here, and it's a preview for Kauai. It really is a preview for Kauai and what we can do to be sure on Kauai that we don't have make the same mistakes going
Well,
forward.
Doc, I do want to say, Mel and I was just talking about it before you came in, and that is, you sort of made a prediction about, because we asked, what you were going through in Utah,
Mm-hmm.
and you told us, if you're not careful, and you pretty much nailed it right on the spot when it was going to take place. You said that Hawaii could be like Utah, and lo and behold, bingo.
Yeah.
in 2 months,
Yeah,
Yeah.
you said that,
two
and
months.
bingo, this is what happens. And now, we're talking about all these other things. So I think, you've got a lot of, right now we've got a just online, but it's we have many more viewers other than what's online now, which is about 192. And we know that their ears are glued to the screen because they want to hear what you got. Want to hear
Yeah, great. And I spoke with Mel a little bit, Charlie, about throwing up a couple slides, and I don't want to get too crazy on these slides, but these are interesting to look at because early on in this, truly there was the best of scientists were being stumped by this. We've been all in a learning phase, and we've had to learn fast. We've had to do research quickly. There's been some sloppy research, frankly, that has confused a lot of people. And then the problem is whenever there's a vacuum, it gets filled with conspiracy theories. And whenever there is a slight misstep by the good scientists that you've had on here. Some of them. I watched that night. You had that virologist on from Korea,
Yeah.
Dr. Kim. Great show. That was an awesome show. I learned a bunch that night. But even those guys have been, they've had a misprediction here or there, and people jump on that like that's the end of the world, that we can't believe these guys. It's just not true. We got to go with the science. We got to go with what we're learning, and I think we're at a spot now with what we've learned, we can apply, and we've had a couple of these waves. So, yeah.
Well, Doc, you have total control of your screen. So whatever you want to do, it's your show. Really, it's your hour. So,
Okay, let me pop this up, and we'll interject at any point with questions, and we'll see what comes of this. And if I don't know if chat questions come in, if anything comes in. So what we have here, this is actually done by our group here at the University of Utah. This slide, you see that? Okay.
Yeah.
yep,
Okay.
nice.
Yeah. So Hawaii, this is because it's mostly looking at the big surging states, and Hawaii was more along the lines of coming along down here, flat, and then is coming up right here. And it's Hawaii as a whole is kind of kissing Utah right here with 200 to 300 cases a day. Utah, where I am, came up slowly, went back down, came up again, and is now headed back down again. So I think we had 400 a day. We had 200 and something the day before. But here's that Memorial Day that we talked about, and we knew that this was going to happen. And here's those big states like Georgia, Florida, Texas, Arizona. Those are the ones that really spiked up. We actually had patients coming from Arizona or asking to be transferred up because they hit that ICU threshold that was just too much. They couldn't cover it. And we know that on the islands that in Hawaii, we have a very different consequence if we hit that. We don't have anywhere to send those patients over there. So we got to be that much more vigilant to not hit that because we can't just go to the next state and send patients over there very easily. So right about here, for a lot of these states, including Utah, the mayors instituted a mandatory mask rule, and that's what's turned that corner. Now, having said that, we got a lot of people that just don't want to believe that. And what I want to show you today with some of these slides is just more evidence that all we have right now, because we don't have a vaccine, is masks, social distancing, and hand hygiene. And so there's lots of people who would say, this is just the ups and downs of the virus. You just can't convince me that these masks are important. Well, let me just show you a couple things here. Next slide. So this is a slide of the Spanish flu clear back in 1918. It had these ups and downs, these trimodal spikes. All of these were as a result of not the virus itself, but social changes, moving of military troops, and not understanding the dynamics of the contagion. Here is H1N1 that was just 10 years ago. Same thing, big spike, second wave, third wave, all because of kind of a different approach. Now this next slide is the interesting one. So this is Australia. This is now, and we're looking at viral illnesses and then truly confirmed influenza A or B. And in both these slides, here's about 5 years of data, 2015, 2016, 2017, 2018, and then the 5-year average. So we see, because they're in the Southern Hemisphere, of course, their flu season starts in May, ends in August and September, whereas the Northern Hemisphere flu season starts more in September, October, ends in January, February. So this year, this is the last 5 years of flu season coming in, lots of people getting the flu or flu-like illnesses, and then it tapering off like it does every year. This year is in the red because Australia has had a very strong and aggressive approach to social distancing, hand hygiene, and face masks. And so you see here, influenza has almost gone to zero in Australia up to today. That's unheard of. And the only difference are these three things this year. So, you know, we've learned a lot. We just early on, you remember the experts saying, yeah, we're just not sure that masks, that regular masks are going to do anything. Don't wear masks. What we've learned through the last 3 months is that it does make a difference. Social distancing, hand hygiene makes a difference. So much so that if a similar respiratory disease, influenza, has nearly been flattened to zero because of it. So this is the proof we're talking about. There's no other reason why the flu didn't do this again as it did last year. So that was one other point. And I made the point for our folks here in the Intermountain West by bringing back up the Johns Hopkins coronavirus map. And we see, as we look at each of these states, here's the graph, the graph of the last month for each state, kind of laid out the way the United States is laid out. And we see some of these places like Florida that have these massive spikes. Here we've got Hawaii here, who with its current rise, still relatively low compared to others, but not relatively low for us. This is very concerning on Oahu. And you can see that it's still headed up. These gray bars are here in Utah. This is the spike. Here's where masks became mandatory, right about here. And here's this tapering off. Here's the current hospitalization rate. And this is that problem that we were talking about before, where people coming in with COVID, especially those that end up in the ICU, have a 9 to 12 day hospitalization. So this hospitalization graph lags behind the drop in test positivity. So this will start to fall down, hopefully in the next couple of weeks. And this is cautious optimism. This is really what's happening, because right about here is where that mask mandate went into effect. But curiously, the governor of Utah only made it a mandatory mask wearing in Salt Lake County. So here's Salt Lake County, where we're coming up, and then it's starting to taper down. The rest of Utah County, has had this rise, and this is where a lot of people don't wear masks. They're just non-maskers, and they've continued to rise, and the hospitalizations have done the same. Here's Salt Lake County. This is just the main big hub. It's kind of like our Oahu, the capital of Utah. And the mask wearing mandate was instituted here and started to taper down. Here's the suggestion of mask wearing, and all it did was stop the uprise. It's just kind of flattened. So this is just, again, ongoing evidence. And it's really tough in a place like Kauai, where the number of active cases is so low that we just don't know that many people that have the disease, and we're just not quite as motivated. So I'll pause there. Any thoughts or questions on that? The real part of those slides was to show you that fairly remarkable phenomenon in Australia of how mask wearing has affected influenza, and convince those who may not believe that it works to just do it. And as I mentioned before, the only businesses that have really stayed open through all of this have been hospitals. And the University of Utah Medical Center has 2,500 patients, or not patients, but employees a day that come in and work there all day long next to each other, still trying to social distance, but hand washing and mask wearing. And over the last 5 months, the University of Utah Hospital, with that many people coming to work every day without a break, has had one case of transmission inside the hospital from one healthcare worker, from one patient to another, only one case. So I'll pause there for a second. Any thoughts on that and how that might apply to Kauai going forward? And then I'll come back to some school stuff in just a second.
Well,
Mel?
I think I don't have any questions on the slides. I think that's pretty graphic. I know we still have anti-maskers. They're out in force today in front of our county building protesting. No masks, by the way, holding their signs on Rice Street, uh, telling everybody, no vaccines, no masks, no quarantines, none of that. And it's kind of scary, I don't know how we get this message across. I wish more people could see these slides, and hopefully they'll share this. But
Yeah.
it's quite clear by the stats. And again, Doc, it's a relatively new virus. We're learning every day. The more data, the better decisions we can make. But this is pretty clear. The mask is vital,
Yeah.
and it does cause the hospitalizations to go down.
Yeah.
The question is what there's so much talk about masks, and now airlines are saying oh, you cannot see my screen, but
I can see you. Yeah. You're up in the corner of my screen.
these types of masks are not going to be allowed, the ones with these little filter pukas. And
Yeah.
but what's cloth masks? Everybody wants N95s, but it's not something you can just go down a store and buy. It's tough to get.
Yeah.
um, what's your suggestion as far as Kauai? We're pretty good, I gotta say. Most places I run around to, I see people wearing their masks.
Yeah.
And
Yeah. So two thoughts real quick, Mel. I think one is
you can, if you wanna unshare the slide, you can do that now, and then come back to it when you.
Yeah, we'll come
Yeah,
back.
our viewers, they have a thing about leaving the slides up. I don't know why. They want to see your gorgeous face. So,
Yeah. Yeah. So two things. One is that I've had, because of my role in being the outreach director for the Intermountain West for COVID, I've just, it's probably a little bit like you guys. You almost get question fatigue. We've been asked these questions so many times over and over again, and people are well-meaning. And one thing I've learned is that I don't want to alienate people. I don't want to disregard those people that were protesting yesterday on Rice Street and say they don't have a point at some level. This is really hard on people, and I'll show you some slides again in a minute of a survey that was done of the stress levels that are affecting people. And when I was working on island this last month, I've got employees that are, they've got to come to work, and we had to create a little place for them to bring their kids so that they could work down in the clinic because there's just nowhere for them to go. They're not going to school, and it's a tremendous burden on businesses. And it's not just a sacrifice of money, but it's a sacrifice of mental health and a lot of domestic stresses that people are under with budgets and trying to make this work. And so the frustration is real. I would say that my message to those folks is work with us, because you really can have both. And Kauai is a good example. You do, like you said, Mel, you do go around and you see people wearing masks. You see businesses altering the way they work a little bit, but still open. A lot of them are still open and still trying to sell food. And, there's a lot of recognition of doctors and nurses, but think about these folks that are working in grocery stores. Those guys are heroes too. And they shouldn't have to be exposed. But if you can wear a mask, these grocery stores can stay open. It's going to be the same with teachers. Teachers are heroes to me. And if we're going to open up schools in the presence of COVID virus being in the community, we got to help protect them. So work together, and we're coming up with a lot of creative solutions to get businesses open. And it may be that the governor will see that it is safe enough to have folks come at some level, be tested, and then come off the quarantine early, and then we'll get some more of the folks coming that will help some of these other businesses that depend so much on that. So I really do think there's a middle ground until there's a vaccine. The second thing regarding your mask, there's a, yeah, like we talked about early in the show, there's a lot more data and a lot of research, published research now. And yeah, all masks are not created equal. Those ones with the little puka on the side, because of that,
Yeah,
that
they couldn't see earlier. They couldn't see it because we're on the. But this is the one that I'm seeing that some of the airlines are not allowing people on the plane with this mask.
yeah, because the theory is that this is a one-way vent. So you're not catching your particles, you're just protecting yourself from other people's particles. So I would say that's the reason why for those masks. And the other masks that are are not created equal are just a single layer of cloth. If you double layer that cloth, and most people that are hand making masks are really doing a pretty good job using fairly dense material. It's not that you're trying to stop that little teeny virus, but that virus lives in little moisture particles that are caught up in that cloth mask. Now the masks that are medical grade, not the N95s, but the ones that are just the pleated medical masks that are fairly inexpensive, you can buy at most stores. They actually have an electrical charge inside of that cloth that helps also bind virus and bind molecules. So they're a little bit better than even the cloth. The N95s, of course, are designed to be fitted so that you really have to only breathe through the filtering of the N95 and pull air back through that same filter, where the cloth and other masks, you entrain air from the outside of the borders of those masks a little more. The N95s are therefore more expensive, a little harder to get, and we use them in the ICU when we're really going into an exposed patient. They are that much better, but you really do have to be fitted to them to get the advantage. Otherwise, if you're still blowing air out the sides, you're not that much different than a regular pleated mask. But those N95s are not very comfortable to wear too. They're a little bit hard on the skin. We've actually, in our dermatology clinic, we've had a number of people come in, that have broken out into acne. And that's probably because they're wearing a mask without washing it. So those cloth masks, if you can wash them and really sanitize them, have a few of them so that you can cycle them, that's going to help. And then the pleated masks, after a little while, you should probably toss them. So that's kind of a brief summary on the masks.
Hey, Doc, you know that, I'm sorry, Mel.
No, I
Go
just want to real quick on the pleated masks, because that question just popped up as you were saying. Is there a shelf life of the electrical charge on those pleated masks?
There is, and I don't have it off the top of my head, but there is. Yeah.
Those one-way valves, because I have one too, but within that one-way valve, I have a triple layer. Is that still considered? It's as if I was wearing a mask with triple layer, but it's just that one area.
Yeah.
They come out with a cutout with a triple layer that's in there.
Yeah. So I think that's another good point, Charlie. I think that as we navigate COVID, sometimes we throw the babies out with the bathwater. We lump everything together, and every time, so that you've got the stewardesses on the airlines who just have been told, if they've got that little puka on there, then it's a bad mask, and that's not true. That's not always true. Some of those masks actually are the equivalent of an N95, and it's a question of whether you're going to argue with the
Right.
with the stewardess on the plane about it and try to explain that yours is different, and maybe they'll understand that later. But it's, if it doesn't say it in big bold letters, this is equivalent to an N95, they may not believe you.
Okay.
At some point, Doc, and I know you have more slides. At some point, I wanted you to share with us on the contact tracing programs in Utah, in Salt Lake City, if you got some time. But I know you had other slides that you wanted to share.
Yeah. So let's let me jump back to, this is a little bit of a change of subject. So this is talking a little bit more about schools. So the going back to school thing, if you think about it, I'm going to actually jump ahead here real quick and I'll come back. So this is an interesting slide here. And I'll send these slides to you so people can ask for them,
Perfect.
request them.
Perfect.
This is the risk. This is the relative risk of a bunch of different activities. So going to a bar, as we've seen in Oahu, is like right up there at the top. Going to a sports stadium, attending a large concert. The reason for this is it's not just because people are close together, but these places are loud. And so people have to yell to communicate in a bar, in a sports stadium, or in a large concert. In church, the other problem is that you got choirs singing. So it's literally how far you project your spray. And we saw that in Washington when that whole choir got sick clear back in March. And then, just coming down, you see all the different categories. But here is sending your kids to school, daycare or camp. So the school thing here is the real big question on the mainland right now and in Oahu as the school year approaches and we have COVID in the community. Um, this graph goes along with a campaign called Stay in the Green. And so they're really pushing to try to keep people down in this green, more green area. And schools kind of sit on that fence here. And so it's not that going to school as a concept is absolutely wrong and we shouldn't do it. It's that if we do it well, we can do it, but it's got to be with some real creative approaches. So let me jump back and the American Academy of Pediatrics feels very strongly about this, and you can look this up. I'll send you the link. It's a multi-page statement about how important it is to not only recognize the dangers of COVID, but how important it is to recognize the dangers of not going to school. They're not as life-threatening, they're not as scary as dying from COVID, but they are significant. And this article kind of goes through that. There's a significant amount of stress. And so we did a survey at the University of Utah, and it's not over yet, but we have over 3,000 people that responded. And this is just asking employees what are their concerns, managing home and work. And some of this for sure applies to and would likely apply to anywhere in the country. So the top work balance needs are, fairly obvious. You'd think continued opportunity to work from home. That's number one. The flexibility in scheduling, meetings, shifts, classes, clinics. So having a boss that understands that you've got to take care of kids, you got to take care of your kapuna, making sure that they get to their hospital appointments, all those kinds of things that you didn't maybe have to do before are a concern that needs to be addressed. Knowing the work schedule and the school schedule at least a month in advance. One of the hard things for us as Americans is that we like to be in control. We're not a socialist country. We really believe in our freedoms. And all of a sudden to have this COVID thing changing everything all of a sudden with very limited notice. We had anticipation that there might be a change September 1, but all of a sudden 2 weeks before September 1, the governor says, no, we're staying with the quarantine. That changes a lot of people's lives. So that's another concern. Managers who understand these things, and then getting down to the childcare issues, in-home childcare, in-person tutoring, consultation with education specialists, online tutoring. These are all major concerns. And parents are dealing with this, especially where COVID is in the community. Sliding over here, you see that the stressors of work are much higher for those with children at home or kapuna at home. With you've got people that you got to take care of, and a lot of these people are considering leaving the workforce, which is a really tough thing to do. Some of these people are considering reducing their hours. They certainly do it more with kids at home. Reported reduced school work productivity, and say that career development has been impacted. Next slide. I'm going to jump over this one to this one. This is just obvious, I think, to all of us. How much stress are you currently experiencing as a result of the COVID-19 pandemic? Clearly it's up in the 7, 8, 9, 10 range. And so again, this is affecting all of our lives. It's affecting our children, and it has a negative impact on them, has a negative impact on our economy. What can we do about it? What can we do? There is a middle ground, and it really is that trifecta of masks, social distancing, and hand washing, and learning creatively to combat this stress that's right here, and find a middle ground. Because if we don't do going back to school well, we're going to have another surge here in the United States. And you guys have watched the news. UNC, UConn, you watch the news, and there's these pictures of parties with 300 kids jammed into a space, and they just had to shut down those schools. That's not the way we're going to be able to do this, because that's going to bring on those surges. This is just some supportive things that we can do. Ask people how they are doing at work. That people feel disconnected during this. Validate concerns. Discuss the impact of on group and local needs. Connect to resources. The governments tend to move slowly, but there are quite a few resources now at the state and federal level to help with homeschooling and things along those lines. Make sure, if you're a boss of a business, that flexibility and scheduling and remote work are things that you're transitioning to, so that your employees are able to navigate this. For those of us in healthcare where we have to go to work, really being aware of stressing our employees in a way that is taking them to the brink. We've come up with very creative nursing shifts and doctor shifts to be sure people get out and get home. And so these are just some of the things that we're doing. So I'm going to jump back off those slides and pause again for any questions and thoughts as I threw that stuff out about just how this is affecting families and workers in businesses.
Well, the question I had is, again, the schools. I just read a report today that I guess studies are showing now that the children are now becoming the silent spreaders, because they're spreading it. Um, so I would assume, based on just from a real simplistic approach, that when you talk, it's aerosolized so much before the droplets drop, right?
Right.
So if so, I think the danger would be between child and child, probably same height. But if you're talking about an adult who's much taller, unless it's projected upwards, it'd be highly unlikely. Yet the reverse to it would be an adult talking, the droplets drop on the kids.
Yeah.
So, you know, one, oh, and the other thing you talked about was like in the churches and the bars, the amplification.
Yeah.
So would you think it would be something sensible where if teachers are going to teach, one, they either have face shields like the kids along with the mask, and or if the classes is spread out, having amplification where they don't have to yell as loud and be able to amplify the sound to get the message across without having an extra burst of energy, which again, you talked about the droplets.
Yeah. So what you're talking about, Charlie, we had a conference call yesterday where we had 23 hospitals talking about educating for schools. And it was just that kind of creative thinking that has helped come up with ideas to improve the safety of teachers and students. And that's the kind of thinking and learning that we're doing, knowing how it's spread, and using that knowledge to come up with these kinds of ideas. So you're exactly right. So having a microphone maybe rather than having the teacher yelling, having a shield rather than just a mask, those are all very good things. Another thing that they've come up with is they're calling them pods, 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 and they're bringing the children down into smaller groups of 15 or 20 rather than 35 or 40. And you've got 2 or 3 or 4 teachers handling one pod. And so if one kid gets sick, only that pod gets quarantined rather than the whole school and having to shut the whole school down. And
Right.
so these are just some of the ideas that, really we're Americans. We're innovative, and it was so disappointing early in COVID to see all of the anger and all of the politicalization of this. And what I'm finally starting to see is good old American ingenuity coming back, and
Hmm.
it's good creative thinking of ideas like that. And I think that's what's going to get us through this is that kind of stuff.
Now, what do you think about if you, because one of the questions was when classes change, right? So instead of moving 30 kids to the next class, move the teachers instead, because you minimize the amount of teachers per student.
Yeah.
You probably get lesser chance of spread, right?
Right, exactly. Yeah, another great idea. And that's how those pods work.
Okay.
That's how those pods work. And
A
then,
a couple of school teacher questions. As a school teacher, and again, it's kind of back towards the mask, but it's popping up. As a school teacher who wears the pleated mask, how often should I be changing into a new one each school day?
so I don't, so I can answer that by what we do with the nurses. When we had a shortage of those masks, we would assign one to a nurse per 12-hour shift. They would wear it the whole 12 hours. Um, I think that there is likely the ability to do a mask the whole day, but there's a couple of mask hygiene things that you need to remember. Our hands and being in close quarters with people make those masks less effective over time. So if we have on the outside of that mask a whole bunch of people talking at us and that mask is blocking that, then the outside of that mask is going to be covered with COVID. And if we reach up and touch it frequently, and I wear a mask all the time and I catch myself reaching up and adjusting it. If you can reach out to the sides and adjust it and not grab it in the front, doing some of that mask hygiene, I think it's safe for those pleated masks to go the full day. And we've done that with the nurses. But you got to remember that you don't want to reach up and touch it. And if you do, wash your hands.
I guess it's so hard to imagine how far, how small these droplets are. People have said that it's like when you see someone vaping on a vape thing, and the mist that comes out,
Yeah.
that could be like COVID, if that person was positive. Imagine that vaping smoke or mist or whatever that's going out could be the COVID. So it's just hard to imagine how many droplets come out of somebody's mouth when they breathe and when they talk. So
Yeah.
just scary stuff.
It's an odds game. And that's why 6 feet is not perfect and masks are not perfect. And washing hands, we say wash for 20 seconds or say the ABCs all the way through as you wash your hands with hot water. Those are just best case scenarios. But the reality is that when even a fraction of the population, 40, 50, 60% do that, even don't do it perfectly, the curve goes down. It does. And, just imagine if we could really convince people to get 70 or 80% of people to do it, you could really stop the spread and eliminate the virus in about 3 weeks. We talked about that before. And there's countries that have done it. I mean, Japan did it. Singapore did it. They just had that lockdown approach. But some of these countries have had it flare back up again.
So if we look at Honolulu with the numbers that they've been having,
Yeah.
um, it seems that I would say between, like you say, about 60% practice, but that it seems like that 40%, and that's assuming that they're the ones getting infected and affecting all these numbers.
Yeah.
And basically, they hold the state hostage
Yeah.
because, I mean, it's we had a congresswoman on last night, to talk about what needs to be done to tackle this problem. And I think later on, after you do your last presentation, where we can have a really open session, I really wanted to know, because you had predicted it, what did you folks do to bring it down, and what would you recommend to Department of Health here? Because it seems like we've been so discouraged over the last week or so
Yeah.
because of, and you were here, you see some of the press conferences, and
Yeah.
you're in the trenches, you're a practicing physician yourself, that it really hurts when they say that contact tracing is really not important. I mean, basically that's what I said. And it's like, oh, okay, then why are we going through this exercise for? What's important?
Yeah, I was a little bit disappointed in that. And this is back to Mel's question on contact tracing. Um, it, there's not a black and white answer, and that's why they could come to that conclusion, because contact tracing is super effective um, at the early stages, at the early beginnings of community spread. It becomes a huge drain on resources if that spreads so fast that you literally sap all of your resources. Um, and it's like chasing crabs on the beach. I mean, you just can't catch them all, and and that's, I think, where some of that is coming from. But the principle of contact tracing is is really important, and that's why I agreed with the closing when Honolulu took off like it did, closing on the inter-island travel, because that leaves our island on Kauai. We still have the ability to implement the most productive contact tracing there is, and we've done it. And that's why the numbers stay low. We quickly, when people are, but contact tracing has to go hand in hand with testing too. So people that are symptomatic have to come in. If we have somebody that's symptomatic and says, hey, I know I might get in trouble, or I don't want to be made an example of, they don't come in, then that's how it breaks out of the contact tracing benefit. But people have come in, gotten treated, gotten tested, and then we've quickly found out who was exposed to them, kept that group quarantined, and then we have that one or two, then it goes away. 4 or 5, then it goes away. But if you get into the 2, 3, 400s, then it's a huge drain on resources, and it's a little bit of a chasing your tail game. And so I understand some of that need to save on resources and focus on other things. But it was a little disappointing to hear that they were kind of not wanting to do that.
Well, they do now. I mean, now they seem to be ramping up, but it's we're kind of behind the 8 ball. Like you said, we're chasing so many, and you have limited supply of contact tracers, then it's hard, and we're not doing an effective job because there's just too many cases on Oahu anyway. On Kauai, I can tell you, I just communicating with a friend today who's on the one positive case, and the DOH was right in touch with the family member. So it can work. When you're getting 1 or 2 cases a day, you can get it done quite effectively. But
they missed that window on Oahu.
Yeah, it's kind of hard, but it doesn't mean it's not effective. We got to do our best. I mean, you do your best with what you got. How is Utah handling the contact tracing? If you know, I'm not sure. I'm assuming they got a handle on it.
Yeah, so I think they had similar challenges. Government resources are always strapped to have enough to do all those things, but they didn't back off on it. They have, the Department of Health here has been pretty aggressive at tracing those contacts. When it got up to that, we were at one point, we were at 800 cases a day back about a month ago, maybe 3 weeks ago. And I have no doubt that we exceeded our contact tracing capacity at that point. And it, again, like you said, it doesn't mean we should just throw in the towel and stop, but it needs to be in combination with the mask mandate. And it was really that mask mandate that brought it back down to where contact tracing becomes truly effective.
Now, Doc, being a ER intensivist like yourself,
Yeah.
um, at what point does someone get hospitalized? I know it sounds like a crazy question, but we're facing some situations here that calls are being made that said, you can go home and isolate, you're positive, but the person went into the ER because in the first place, because in their belief, they had to get some kind of medical intervention. That's why they went
Yeah.
there. How do you folks handle it in Utah? I mean, when do you make that call?
Yeah. No, good question. It's not easy.
Hmm.
And it runs a spectrum of things. Parenthetically, I actually sit on the board of our hospital with a couple other physicians that have to determine who gets a ventilator or not. And we actually haven't gotten to that level, but we were close about 3 weeks ago. When we hit 800, we were pushing the maximum levels of ICU beds. But at the other end of that spectrum, if you think about this a little bit um, like the flu, I know a lot of times we have to be careful about making the comparison because there are some big differences, but a good percentage, the number still remains about 80% of people that test positive for COVID um, have symptoms like the flu or even less than the flu. And there's no need for them to be hospitalized, but there is a need for them to be sure that they're aware that they have it and not spread it. And we would say the same thing about the flu. We're so used to the flu, but if someone came to work and told you, oh yeah, I tested positive for the flu, you'd say, hey brother, go home, man. I don't want you sitting next to me at the cubicle next to me, coughing and hacking, go home. And, the kids would say, Dad, I don't want you next to me. Go up to the bedroom and shut the door. It's kind of that approach. If you're not in need of supplemental oxygen, you're not deteriorating quickly. We don't want to fill up the hospital beds because that's where that 15% of hospitalized and 5% of ICU patients start to exceed the capacity. And we want to keep the ones that can be home. Now, having said that, when people come in to our clinic at Makana in Princeville and test positive for the flu, we give them a set of instructions that tell them if they start to worsen, if they start to truly become short of breath, don't wait, come back, and we'll get you on oxygen. We'll get you moving towards Wilcox, where they have the capacity to take care of someone who's deteriorating. And there's some personal responsibility there to not suffer at home, and that goes also for people who are having emergency situations with other diseases. There's a lot of people that are staying home with chest pain, a lot of people that are staying home with stroke symptoms because they don't want to come in and potentially be exposed. There's personal responsibility there to say, hey, I'm not doing well. And hopefully, and again, there's always stories out there, hopefully our doctors on island are not sending people home that are too sick to be home.
Well, one last question, turn it over to Mel. It's relatively available at CVS. A lot of people are now monitoring their own oxygen level with an oximeter.
Yeah.
Okay. For a lay person, they don't know how much oxygen you should get. And you want to stay relatively in the 90 percentile range, like 95 and above.
Yeah.
What is considered, maybe you ought to think about going in if you were testing yourself at home? What percentage range should that be? Like the honey, get the suitcase ready, I think I may have to go in, that type of thing.
Great question. So the general answer is just what you said. If you're starting to drift into the low 90s, high 80s, and you're sensing it, you're actually feeling short of breath and more short of breath than you were the hour before, then I would probably say that's the threshold. Having said that, though, there are people with chronic lung disease and asthma and COPD that have adapted to living in the 85, 87 range. And, they don't need to come in just because of that other number if that's where they're usually at, or just a little bit below that. But,
Okay.
but as they get down in, if those people that live around 80 or 85, 87 get into the 70s, then it's a relative change for them, then they ought to come in. But combine it with symptomatology and make sure that you're using that oximeter correctly, because if you're not getting a good pulse signal that matches your pulse, you may get a lower number than you're actually getting. And if you have fingernail polish on, that will affect that reading too. So you got to be sure you're using it right.
Okay.
Good question, Charlie.
Doc, in Utah, I know you talked about the mask mandate and the hospitalization started to decrease. Was there any other restrictions placed on lockdowns or business closures? Was there any other restrictions imposed by the governor?
Well, they just continued to restrict things like movie theaters, stadium, sporting events. They didn't open those up, but then on top of that, they made it mandatory to wear masks. Before it was voluntary, and it was just a single event of doing that. As we've curved down, they've started to open up to sporting events. It was really interesting. So my daughter plays competitive soccer. She's a senior in high school. I went to her game today. The school district required that assigned that one player only could have 2 people come to watch her, and you had to sign in advance that you were one of the 2, and then they were going to check you at the gate. And then of course the stadium where the soccer game was almost empty. I mean, it was maybe there was 100 people on one side, 100 people on the other, and they had all the bleachers marked at 6 feet. So they're trying to do things to make it better, but yeah, to answer your question, they went from voluntary masks, and then some businesses opened, but movie theaters and gatherings of more than 99 people were forbidden, and to then just making it a mandatory mask at all times in public places. And that's what rounded that curve down.
So prior to the mandatory bars, restaurants, gyms, spas, all of that was still open, you didn't have an issue with that?
No, bars were closed, mostly takeout. Restaurants had opened with social distancing and outside dining mostly. Yeah, there were some restrictions there, but the thing that really turned that curve was just a mandatory mask and social distancing.
We're trying to figure out Honolulu. Obviously, they set up some tough restrictions with no gatherings now, no social gatherings indoors or out.
Yeah.
No gatherings, or even in your household, of more than 5 people.
Mm-hmm.
It's interesting. Even couples, if you're a boyfriend and a girlfriend and you live apart, you're not allowed to stay in the same house. It's really bizarre.
Yeah.
But yet the restaurants are open with the bars, the gyms are open, the water park. They close the beaches, but they let the water parks stay open.
Yeah.
The people are wondering and confused, and what's the logic?
Yeah.
I'm thinking maybe he should have just went with the mask mandate, left everything as is, and force everybody to wear a mask. And I think that may have a better outcome. Yes, you're gonna have those that don't like that, but I mean, gosh, to not be able to see your fiance because she happens to live in another house, that's kind of crazy.
Yeah. No, I think you're exactly right. And I think if there's a main message tonight, it's that that there is a middle ground, and it's masks. And I think as we saw 2 weeks ago, there's this outbreak in Oahu. I think some of these strange and contradictory rules are as a reflex reaction to
Yep.
having made a mistake. They made a mistake, and
Well, one person brought this up and basically said, when you get a rule that in open spaces no more than 10 can gather. Well, theoretically, if there's going to be a gathering, you got 100 people, and law enforcement comes there and says, "Hey, I don't know the other 90. I'm with my 10 here. It's just the optics that everybody's in the same place."
yeah,
So I wish sometimes they would make rules where it says, 10 or less at a location. You cannot have more than like one group.
yeah,
Then that would basically send everybody away. But it's a crazy thing. It's a crazy thing.
yeah. Our poor police officers. I mean, it's
Yeah.
just, can you imagine trying to enforce this stuff? Oh my gosh. And they get a new thing every day, every week. It's just like, what's the law today? And God bless them.
Oh, did you see the Mel? Did you see the stuff that came up from the public defender's office telling the chief of police? Memo came out asking chief of police that because of overcrowding in the prisons or whatnot, if you tell your officers if they see an offense committed, basically look the other way. I'm like,
Don't arrest them.
yeah, don't arrest them. But,
Put a temporary hold. Awesome. You're telling people that there's a quarantine. There's all these laws about congregating, and yet public defenders asking the chief of police in Honolulu not to arrest any of them.
Yeah.
Come on. I mean, I don't want to see anybody get arrested, but at the end of the day, we all do what we can to get rid of this virus, or at least to bring the numbers down to a manageable number. What's really sad when you look at the numbers in Oahu, a lot of that is because of clusters in the prison. That's a ton of the numbers right there. You got Maui Memorial, ton of the numbers. It's just these clusters
Yeah.
in government facilities, which is that's what gets me. I mean, if the people are doing their job, the lay people sitting at home, wearing their masks, washing their hands, staying 6 feet, in fact, just staying home, and not doing the things that they normally do, because we're all trying to do this. And then in the government facilities, we cannot get it done. And a large chunk of these numbers that's, skewing the statewide numbers are big clusters coming out of, individual entities. And that's a shame. That's really a shame, but it is what it is.
Well, I do want to end on a good note, because I am cautiously optimistic that what we have learned over the last 5 or 6 months is really good information. I mean, we really do have a way. One of the most helpless feelings we had was a couple of 3 months ago, and we just weren't sure what to do, and we weren't sure that masks helped, and we weren't sure of these things. It'd be one thing if you had to drink Lysol, that was the only thing we had, or something that was really hard. You had to.
Not bad, actually. It's not bad.
If it was something really hard, but we really have the good news, the cautiously optimistic news is that we've shown 2 or 3 times now that something as simple as putting that mask on your face, getting used to it, staying 6 feet apart when you're out in public, and washing your hands, not hard stuff, is the answer. And for now, it's all we have, but it works. And that's optimistic. That's an optimistic thing that's been proven. And, hopefully some of those slides show that it works for other respiratory illnesses. And if we can do that, we can start to open businesses and get a lot, work together. We don't have to have all these crazy rules about fiancés having to stay apart and only 5 people. We can really, but it comes to individuals really buying in at a majority level. And then I do the second optimistic thing that I would say, as a scientist, I've published 30 medical papers. I read these papers on the vaccines that are out there. We've got what I think are very good vaccines coming down the pike. And so we have a solution that will work until then, if everybody gets on board. And we have hopefully an answer to the major component of this problem coming, again, still probably first quarter of next year, but it's coming.
Hey Doc, I know we're almost at the time. I did want to get actually two quick questions in. First one, difference between a KN95 and an N95 mask.
So you know what? I have to plead ignorance on that, except that I know that the KN95s, I think they're made in Korea, aren't they?
I don't know.
Yeah, I think I don't know. I'll email you the answer to that because I know where to ask for that, but I don't know.
Yeah, I mean I'm sure. I apologize for springing these questions up, but and then the last one is as it relates to the vaccine, and without getting into details of who's going to get it, blah blah blah. I just want to know, generally speaking, from the date that this vaccine is introduced into our world or into our country, how much time before we see an impact on the numbers? Is that a prediction that can be made even? I don't know.
Yeah, I think that's a tough question too, but it is if we extrapolate from previous vaccination efforts,
Yeah.
like
Mhm.
with the flu, um, the flu vaccine is not that spectacular. It has about a 50 to 60% efficacy because influenza changes so much. We don't think coronavirus mutates the way the influenza virus does. So I'm going to predict that I'm 1 for 1 on predictions, thanks to Charlie. I'm going to go out on a limb and say I'm going to predict that the coronavirus vaccine is better. It's going to be more effective than that 50 to 60%, and that it's like having it that over a several week period we'll see the impact, and it won't be so much how fast the vaccine takes effect in humans. That'll be a several week period of gaining that immunity. It'll be how fast we can produce it and get it to people.
Right.
And that's going to be the trick. And I think, it's probably fair to get it to those who are hospitalized or in nursing homes, and to healthcare workers taking care of those people and the
Yeah.
immunosuppressed first. And then, making sure that there's fair distribution without socioeconomic biases or anything like that around the world. And vaccines, I think the way we're ramping up, we should be able to do that.
The N95 Mel and KN95, the materials and properties are pretty much the same, but the N95 is a US standard and the KN95 is a standard that China uses.
Okay. Yeah, I just read that myself. I was
Yeah.
trying to Google fast. But you beat me,
Awesome.
Charlie. Yeah, I just saw that. Yeah, I knew it was China or Korea, but it was just a different standard. But they, as you read, they're pretty much the same capability. Right. And then I've found that the KN95s are typically less expensive, probably because they're made there and not in the United States.
Right.
Speaking of that, hang on real quick.
While Mel's getting something, Doc, I wanted to ask you if you read the report. I shot an article through Facebook today. It's about the Mount Sinai discovery, or they started to listen to those bubbles from the lungs, and they was finding those small bubbles up in the brain, and they were wondering why on ventilators they weren't getting enough oxygen, and that possibly some of because of COVID, the capillaries in the lungs so dilated that it passes through, it just goes straight through.
Yeah.
You saw anything about that?
Yeah, I think it's an interesting theory. I'd probably hold out on hanging my hat on it yet, but when you do have what we do know is that the COVID virus ravages the lungs. It's a very inflammatory process, and when you start to have, you have the capillaries next to the air sacs,
Right.
and when those air sacs are damaged and the capillaries are swollen because of the higher pulmonary blood pressures, that there is easier transmission of oxygen bubbles, if you will, or what we call emboli, into
Yep.
the bloodstream. And there is some theoretical truth to that, but I think that it's a phenomenon that
Yeah.
I'll kind of hold out on confirming in my own experience. We've found that that this is a little bit of a medical jargon, but there were for injured lungs, there's the theory of low stretch, low ventilator volumes that was recognized a long time ago with ARDS. And we found that really adhering closely to that approach, not using big giant tidal volumes that cause barotrauma to the lung, um, really works. And we don't have as much trouble with just plain not being able to oxygenate people. Those kind of folks have usually waited too long, and the damage is pretty significant. And when you put them on a ventilator, it causes even more damage. And it's really not the ventilator's fault. It's really the delay in getting them on gentle, low stretch ventilation.
All right, Doc. Thank you very much. Appreciate you back again. Again, I apologize for the time difference. Gosh, you're all the way in Utah.
No worries.
I did want to, while we're talking about masks, I did want to say that these masks here are from Korea, from our friend Miniko. She donated about 300 of these. We're going to be passing these out on Saturday. Charlie and I, Tyson, Rhonda, and our good buddy Troy Wallali will be at Medina Stadium from 11 to 1. Keikis, Kupuna, and veterans. That's it. If you don't fit in those categories, don't come unless you're going to bring lunch. This is antibacterial, fast drying, UV protection, reusable. There's a 3D fit. It's nice, and it's anti-splash. It's 92% polyester, 8% polyurethane. And the nice thing, it comes with an Aloha.
Nice.
He had it designed with Aloha.
Yeah.
But if you're like me, you turn them inside out. There's no seams or anything. So no more Aloha. Anyway, nobody gonna think for me, they're gonna think I'm a tourist. Anyway, Charlie, any closing comments, my friend?
Well, this has been a fascinating hour. It's always a pleasure to have you, Doc. And like the last time and today, this time, it went by so fast because there's still a lot more. And I appreciate the charts. And in the beginning, I just couldn't quite understand until you put it into plain English. And I think I wish more people would watch this, and I'm pretty sure there are, and get a better understanding of what's at hand. And like you said, the simple things in life can really turn this virus around. The simple things in life, wear your mask. So I'd like to say thank you. Firstly, thank you. And to the viewers out there, thank you for the questions coming across. I know we didn't get to all of them, but as always, love you guys. Appreciate it. Mel?
Thank you very much. Oh,
thanks, Charlie. One just quick shout out. I wanted to, I don't want to embarrass him, but the Ryan Graves family on the North Shore, he and his wife Molly donated a tremendous amount of masks to Wilcox and to the Makana North Shore Clinic. And I just wanted to publicly thank them for their kind donation. And it's really helped. So, and thanks to you guys. I really think you guys are doing a great job keeping the truth out there, keeping people aware and alert. And I'm pleased to see your show growing and love to come back again. And I promise you that I'll have some great new colorful charts again next time. And we'll see if my predictions come true too.
Oh man, I tell you, you hit it the last time. I remember specifically you said, we were where Hawaii is at 2 months ago, and today we're chasing New York. I remember that as if it was yesterday. And as we started seeing the numbers jump, I want to thank Maka'ala Kaumoana for reminding me to ask you back on, and appreciate you responding and coming on. It's always a pleasure to get people that can come back and talk about what's changed from the last time you were on. And there's been so many changes everywhere, here in Hawaii and Utah and everywhere else. So just thank you so much, Doc. And you stay safe up there. if you got a family up there that's allowing you to share some time with us, thank them for us as well, because I know I know you're a busy guy.
They're all in bed.
Okay, good, good.
Yeah. No, thanks, guys.
For the viewers, tomorrow night, 7 o'clock, we have Senator Kai Kahele who will be on talking story with us, giving us some updates and insights as far as the legislature. And then Saturday night, Brian Ingalls, our statistician, will give us all the new numbers. It's going to be exciting as well. So until then, aloha, everybody. We love you guys. God bless. Stay safe.
Aloha.
Aloha.